Well, one evening just before I got off work, I got a call to go over to the behavioral health and speak with a gentleman, and he was in crisis. I'm feeling my emotion come up. He came in very distraught and confused, teared up, concerned about his mother. He'd been houseless for a few years, so he had been living on the streets and struggling, just trying to find, food, shelter. It had been a while. He'd gone in and out of the hospitals many times, the emergency room, and somehow just kept falling through the cracks.
Morag connected the man with various resources, including the Addiction Recovery Center. She walked him there to introduce him, and soon after, he stopped drinking entirely and continued to go there nearly every day for months. He also continued coming back to Morag.
This gentleman, ended up being diagnosed with dementia. He was incontinent. He wasn't able to take his medication on his own. And so, there were many things that were obstacles. And so when you have an individual like that trying to stay, for instance, in a shelter, it creates problems for everybody else, right?
Morag persisted, calling herself the squeaky wheel, as she continuously worked with various organizations toward finding a housing solution for him.
I can't tell you how many of my fellow co-workers, community health workers, etc., helped out, whether it was bringing a hot cup of tea, because this was, during the first few months of the year, it was freezing outside. And he would literally be there just purple. I mean, I can't tell you how many nights, I double-checked that he had a sleeping bag when he's laying on the cement. And yet he was always gracious. He didn't care how uncomfortable he was. Just the fact that somebody was caring, I think, really is what it was that kept him going.
After lots of perseverance, teamwork, and time, the team managed to get the man into an assisted living facility in Grants Pass.
I knew from back in the early March where he had been sent, which was, such a victory. And, there were so many people that were like, yes, right? It was amazing. Then I wanted to get permission from him if I could and find out. Plus, I wanted to know, where is he now? And I found out that he's on the coast, and he's, where I'm gonna tear up. He's in a, darn, sorry. He's in a memory care center. He's on the coast. He's getting his 3 meals a day. He's safe. He said to me, I said, are you getting your medication? He goes, yeah, every morning. I said, do you get to go to the beach? Do they ever take you? He said, yeah, I just was there the other day. He is walking outside every day. He sounded so happy and strong. And he said, I'm really happy. I really like it here. And, of course, he wants us to come visit him. But he sounded so good. And if you could have seen his situation, the thought that this guy was walking the streets for so long, and and now he's totally being cared for. But it took a village to get him to where he is. First we have to open our hearts. We have to be willing to look at that other individual as somebody who is worthwhile and has value. Look at their humanity first. Start from there, right? Then start looking at, well, what's the solution? What do they need right now in this moment?